Welcome. My name is Peter Strong. I'm a professional psychotherapist based in Colorado, and I offer psychotherapy by Skype for the treatment of anxiety and depression, for agoraphobia, for work with addiction, for help with recovery from traumatic memories, such as in PTSD, and also I work with OCD and obsessive-compulsive thoughts and memories and images. Therapy by Skype is a very good choice if you're looking for an alternative to the more conventional medical-based treatments for anxiety and depression. So medications are useful when you need immediate relief from the symptoms of anxiety and depression. But it's important to understand that medications by themselves are not sufficient to treat the underlying cause of your anxiety and depression. If you want to really break free from emotional suffering, you must work at the psychological level. You have to work at the level of the reactive, habitual thinking and the emotional reactivity that fuels anxiety and depression. So that is where mindfulness therapy comes in. And this form of therapy works very well when delivered over Skype. Skype is an excellent medium because it allows you to see each other. And if you can see each other, then therapy by Skype is just as effective as therapy in person. There's really no difference, but you must be able to see each other. If you can see each other, then you will get the quality of communication necessary for effective psychotherapy. So if you're interested in psychotherapy by Skype, do please reach out to me. Simply go to my contact page and email me with any questions you may have. Feel free to tell me more about yourself and how I can help you and what you've tried so far. And if you want to schedule Skype therapy with me, then simply tell me what times work for you. So I see people throughout North America and also Western Europe and the UK and as far away as Australia and South Korea. So mindfulness therapy is about changing things at the psychological level. It's about bringing mindfulness, which is a form of very direct conscious awareness, to look closely at your anxiety or depression or emotional trauma, your traumatic memories, to see how they actually work, what happens in the mind. So one of the first things that we notice when we actually look at our emotions is the whole array of reactive thinking that gets triggered by those emotions. So in mindfulness therapy, one of the things we understand that's a little different than conventional therapy and, for example, cognitive behavioral therapy, is that we understand that thoughts do not cause emotions, but emotions rather cause those thoughts. And the emotions take form in thoughts, and that reactive form feeds the underlying emotion, so creating a positive feedback loop that reinforces the anxiety or depression. Rumination does not cause depression, but rumination feeds the depression. Chronic worrying does not cause anxiety, but it feeds the underlying anxiety. So uncovering the particular reactive thought profiles that are feeding your anxiety or depression is really very important. And that's the first thing that we look at. We look to see what those reactive thoughts are. And then we start to bring the magic of mindfulness to work here, because when you develop mindfulness, what you're doing is you're changing the relationship you have with those thoughts and emotions. You are breaking free from that blind habit of becoming the thoughts, becoming the emotion, which of course is what causes them to be overpowering. You are training yourself instead to become the observer. That's what being mindful means. It means that you are observing exactly what is present in the mind without reacting to it. The reactivity basically causes the problem more than anything else, and it's the identification with that reactivity that sustains anxiety and depression. But once you take away that blind reactive identification, then the reactive thoughts and the emotion underneath are deprived of fuel, and they start to change themselves quite naturally. They begin to heal quite naturally, rather like a wound would heal quite naturally if you stop reacting to the wound in unskillful ways. But if you take care of your wound, the wound will heal. So anxiety and depression are best looked at as being like emotional wounds that basically are trying to heal but are prevented from healing by all of that reactive thinking, that blind habitual reactivity. So we have to see the reactivity, but when you see it, when you bring conscious awareness to it, you then disempower the reactivity. It no longer is habitual. It's now reduced to being simply objects in the mind. So developing mindfulness means seeing those thoughts very clearly. The seeing is what liberates you from the habitual component of those thoughts that is what feeds emotional suffering. The very act of seeing the thoughts is immensely important. We don't have to try and get rid of them. We're not trying to even let go of them. That is simply another form of reactivity. And all reactivity is usually based on some form of fear or aversion. You're trying to get rid of it, even trying to let go of painful memories and painful thoughts is really motivated by fear. And that's why we really don't recommend that approach, because you're just adding more fear to the fear that's already there. So you're feeding the underlying emotional pain. But when you awaken to your thoughts and emotions with mindfulness, you're basically holding those thoughts and emotions in a space, that space of conscious awareness that's not reactive. So you're learning to be totally present with your thoughts and with your emotions without reacting and without identifying. That is what greatly accelerates the healing process. So that is part of what I'll be teaching you during our Skype therapy sessions together, is how to effectively develop a mindful relationship with your mind instead of becoming blindly enslaved to reactive habits. So that's the first part of mindfulness training. And the second part is developing compassion towards your emotional wounds, because that compassion is very powerful. It's a healing force in the mind. The more compassionate you are to yourself, which means specifically the more compassionate you are towards your anxiety and depression and fear and hurt, the more those forms of suffering will heal. So developing internal psychological compassion internally is very important for healing, and that's part of mindfulness therapy. So it works very well over Skype. I see almost all my clients now through Skype. It's more comfortable for you. It's more convenient for just about everyone. And it's just as effective because you can see each other. So if you'd like to explore more about mindfulness therapy, simply read more of the pages on my website. If you have questions, contact me. If you'd like to schedule Skype therapy with me to learn how to apply mindfulness for healing emotional suffering, then please tell me what times work for you, and we can go ahead and schedule a Skype therapy session. This approach is very effective, and most people see tremendous benefits after the first few weeks when you start to apply the mindfulness approach that I'll be teaching. So please contact me if you'd like to schedule Skype therapy with me. Thank you.